The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. You're listening to the Best Birth Podcast, and we're here today with Reva Cook, a clinical social worker, and she's going to take us through everything we need to know about postpartum depression, anxiety, and how we can help ourselves during this time frame.
Reva Cook is a licensed clinical social worker and EMDR certified therapist and consultant. She came to her therapy career through being an ER crisis worker. Her favorite thing is seeing how women's lives and relationships change for the better. As a perinatal mental health and EMDR specialist, she loves and is good at healing trauma and mental health issues that sometimes unfortunately accompany pregnancy, childbirth, and raising children. Healing and handling these wounds creates a big generational positive shift. She likes to say that we are treating clients' grandkids by healing their grandmothers. She's also good at helping work through family of origin, religious, and sexual abuse trauma. She is the mother of 4 young adults, 2 grandkitties, and 1 grandpuppy. She likes to read, go to concerts, be outside, and chase down cool sunsets and pet kitty cats. She's shamelessly addicted to Diet Coke and TikTok. Welcome, Reva.
Yeah. Nice to be here.
So good to have you. Well, let's dive into our topic today with postpartum. How common is postpartum these days?
You know, the really tricky part about stats for postpartum illness is it's based on reports, and in general, mental health is underreported. And when it comes to postpartums, it's probably even more so. But the stats that we have are very concerning, and it's about 25% of all women who experience pregnancy will experience some kind of postpartum mental health illness. That makes it the highest obstetrical complication for women, higher than gestational diabetes, higher than anything.
It's so important that we're having this conversation today because of that. Our podcast is geared towards new moms, also moms who want more education, more information. How do you feel that we can take that knowledge, knowing that a lot of us will be affected, and prepare for a mood disorder to, show its face either during pregnancy or after pregnancy?
I think that having kind of be on your radar, like this is something I should think about. This is a pretty common occurrence. Know the risk factors. Know how many of the risk factors you have. Know what some of the protective factors are. And if you can, the cool thing about protective factors is many of those we can alter, we can change those.
Can you share a few of the protective factors with us just so that we're looking for those?
Yeah. They're kind of the flip side of risk factors in some ways. So maybe we can kind of like do those together.
Absolutely.
So some of the risk factors, being a first-time mom, having a history of being very susceptible to hormonal shifts. So women who experience a lot of emotional shifts around their menstrual cycle, or if they have women in their family that experience those shifts, if they have women in their family who have had postpartum issues before, those are great questions to ask your aunties and your mom and your sisters, and bring those conversations up. Poor social support, having other kinds of trauma in your history or that's currently going on in your life. Having an unstable home environment or struggles with like food or shelter or finances. Those kinds of things are primary risk factors. Now, so some of those, the protective factors we can't do anything about. You're going to eventually have your first kid, right? That's just going to be a thing. Can't change that. And you can't change your family history. You can change your social support. And you can start to build that in place while you're pregnant, or even when you're just considering getting pregnant. you can start to build really solid, good health habits, like a good relationship with sleep. And you can start to work on past trauma that you had before you get pregnant or while you get pregnant. You can work on trying to increase the stability in your life as far as housing, food, and economics, and all of those kinds of things. As much as you can to do those, you can learn a lot about mental health and learn some good mental health coping strategies. And those can go a really long way.
Wow. In looking at my own 3 pregnancies, I can see the different social support that I had during those times. In looking at postpartum depression, we see there's a range. Can you kind of describe some of the different types of the ways postpartum manifests?
Yeah, that's a great question. Um, Postpartum illnesses come in a whole kaleidoscope of colors, so to speak. And the ones that we think of most commonly are postpartum depression and postpartum anxiety. Both of those show up differently for postpartum moms than they do for non-postpartum depression and anxiety. Postpartum depression typically is we call it an agitated depression. There tends to be more anxiety with it generally. Occasionally you see moms who are like, they cannot do anything, they cannot get dressed, but that's not usually what we see. We see a low mood, and also mom is doing all of the things, and there's a lot of anxiety with it. One of the reasons that it makes postpartum mental illness hard to talk about is it's hard to see, because a postpartum struggling mom looks like she's all put together, and it's her internal world that's really struggling. Postpartum anxiety tends to have, not always, but tends to have a lot of intrusive thought components to it, a lot of worries about something happening to the baby. Am I going to do something to the baby? A lot of that kind of stuff, which can cause moms to worry that they're going crazy or they're becoming psychotic or something like that, which is something that can happen in the postpartum period. Postpartum psychosis is a thing. It is a mental health emergency. It's not the same as anxious, intrusive thoughts. Postpartum OCD also can show up as part of that postpartum anxiety package, where mom is having intrusive thoughts and then compulsively doing things to try to mitigate her distress around those. So the kinds of illnesses that we can deal with in the postpartum period range all the way from the mom who can't get out of bed to the mom who's doing all of the things and struggling with a lot of anxiety to a mom who has lost touch with reality.
So many different things to combat, right? When we have that new baby and our world is kind of upside down, we don't know if it's day or night. Typically, if we're helping that baby sleep, tell us a little bit more about the postpartum psychosis, because it is that medical emergency. What exactly are we looking for? And then what do we do about it?
Postpartum psychosis is extremely rare. It happens in less than 1% of women who struggle with postpartum mental health issues. But it is a break from reality, a break from knowing and behaving in ways that are in alignment with a mom's true values. One of the things to watch for is an intrusive thought might be, oh my gosh, what if I were to fall down the stairs? Or what if I were to drop my baby? That's an intrusive thought. One of the things we look for is, how do you feel about that intrusive thought? Is it terrifying? Or if you have a thought about could I harm my baby in some way? How do you feel about that thought? Does that thought make sense? Are you like, it would be a reasonable thing to do? Or are you like, I could never? That distinction is one of the factors that we use when we're trying to decide between, is this intrusive thoughts that are scary, or is this postpartum psychosis? So family members are generally the first ones to notice if there is a postpartum psychosis episode. It may come and it may be very subtle. Mom may not be articulating much what she's saying, but we start to look for these breaks from reality. Maybe she's making some religious statements that are really not making a lot of sense. Or she's saying things like, you know, life would be better off without baby, and she really means it, versus that's something people can say when they're stressed. So that's an important thing for family members to be aware of. And if they have any concerns about that, to head to their nearest emergency room and get that checked out.
Circling back to women who look like they have it all put together, how does that anxiety manifest or affect other areas of their life, such as lactation? They're caring for this new baby. They look like they have it all together, but really, how does it affect their daily life?
Oh, it affects their daily life in nearly every respect. It can impact their relationships. They can be a lot more irritable. They can find it hard to regulate their emotions. They'll find it hard to enjoy their mothering journey. Anything can impact lactation. Lactation is such a complex thing. So you've got physical and environmental and emotional aspects. Like, it's so complex. So to say that an anxious mom would automatically have or be more likely to have lactation issues is probably not accurate. But to say that anxiety could contribute to difficulties in that regard, that might be the case. It also can make it a lot harder for her to sleep, for her to accept help with baby, to take breaks from baby. And all of those things are really important for supporting her own mental health.
Have you found that the time period in which she is lactating can also be hormonally affecting that postpartum anxiety or depression?
It sure can, but not in predictable ways. Some moms find that their moods are pretty stable when they are nursing. And then when they go off, there's no real change. Some moms find when they stop nursing, things come back to normal for them. So that is one thing that we look at when we're assessing and talking about, if you're struggling, what are some of the things to do to be like, how affected are you by hormonal shifts? Or if you've had a history of that, then maybe we should think about if breastfeeding is also impacting you hormonally. But making that choice, so many pros and cons to that, because having that experience with baby also can be really, really positive for mom. So it's not an easy thing to kind of dice out, and it really comes down to what's best for that mom in her overall picture and how she's experiencing nursing with her.
So important. Now, you mentioned a little bit about irritability, kind of having those mood shifts. I think sometimes it manifests in mom rage, right? Like a mom just feeling so angry at her children or at her situation, maybe just like the people around her. Can you tell us if there are a few things that we can do in that moment to kind of help us feel more grounded?
There are things that we can do in that moment. This is also one of those protective factors, that working on building skills about emotional management is so helpful. And some of that is understanding what a window of tolerance is. The window of tolerance is the space in which we can tolerate and manage and feel in control of our emotions. And we ideally want it to be, a good size. And in that range, there's space for, joy and sadness and all of these kinds of things. During pregnancy and postpartum, our windows can narrow because of lack of sleep, more demands on us, trying to integrate new roles into our lives, readjusting who we are. And when your window narrows, it becomes easier to move out of it. And the things that move us out of it, usually stressors. So for example, we have our little mom here. Here's her window of tolerance. She gets up in the morning, and maybe she's right in the middle of it. And then baby is screaming, and she can't get baby to stop screaming. And then she gets baby to stop screaming, but then baby has a blowout. And then she's already tired because she didn't get good sleep last night. And it can move moms out of their window of tolerance. It's incremental, but it can feel so fast because the window of tolerance is low. So we're looking for things that help bring us down out of the window of tolerance. And we're also looking at what are ways we can expand that. And the expanding is like the maintenance stuff. And this is things like prioritizing sleep. We have recommendations for where we would like to be with new moms and sleep in order to protect their brain health. And that is to have 4 hours minimum of connected sleep in a 24-hour period, which is a tough thing to do. So we're trying to just kind of get there. But that kind of lets us know how important sleep is. So sleep helps widen that window. Partner support, social support helps widen that window. Also, if she has already established some good habits of noticing and responding to her mental health during pregnancy and previously, it's been like, I have learned to tell when I'm feeling activated and anxious or when my mood is down. And I've learned when I get anxious, if I do some deep breaths, that's really helpful. Or if I walk every day, that's really helpful. If I stay hydrated, that's really helpful. So those are the things that kind of help widen our window. Now, when we're up there, everyone's like, what do I do in the moment? And I'm like, there are things you can do in the moment. They are going to work better if you practice them when you're not in the moment, and they get built into your kind of general coping strategies. One of my favorite, and I think the best tools for bringing us down are things that are easy to remember. So one of my favorite is to just think about blowing bubbles. And if moms notice they're coming up, be like, I'm just going to blow some bubbles. These are imaginary. I mean, you could get real bubbles if you want, but imaginary. And you're like, long, slow exhale like you would do if you were blowing bubbles through a bubble wand. Soothing self-talk can also be really helpful. Like, I'm okay. I'm going to solve this. This will be okay. I can figure that out. That can be something that can be really, really helpful in the moment. Anything sensory is going to be helpful. So a nice scented lotion that you just take 10 seconds and rub on and notice can help bring us down out of that activation back into our window of tolerance. A nice cold drink, for example, notice the cold going down can help bring us out of those elevated states back into the moment.
I remember hearing to try to activate your 5 senses if you're having an anxious moment. And the one that was the funniest to me was they said to lick the wall. And so it's always been something that I think about. Get yourself close enough to your wall that there's nothing else that can distract you. There's nothing, there's no problem that is in front of you, and you just activate that sense.
Did you try that? Did you ever lick your wall?
I actually tried it once.
I love that.
I actually felt like it really helped. And also because it was like a funny thing. If I was in an anxious moment and then I could say, okay, Sarah, like, are you going to lick the wall? It would kind of help me like disconnect, right? Like if you can try to step out of your place. The other thing that I would sometimes need is like a walk to the mailbox. So taking your baby on a walk sometimes like includes 3 things, right? Like getting on shoes, getting a stroller. But if we were having a meltdown or, maybe there was too much screaming going on, it's like, we're going to go on a quick walk to the mailbox. No shoes required. I can just hold baby in my arms. But we changed our scenery and I could kind of like get out of whatever spiral I was in.
I think you bring up 2 really great points there. The change of scenery can be really, really powerful, especially because you can start to feel really stuck in your house and in your space, and finding ways to do it. Like you mentioned, like, we're not going to do all the hard stuff. The hard stuff is, the shoes and the stroller. We're not going to do all the hard stuff. We're just going to go outside. Especially we're in an area where we have like grass, going outside and walking in grass, so sensory. Also humor. Humor is one of those things that can widen our window and also work in the moment if we can access it. The ability to laugh is one of the things that we assess when we're assessing postpartum depression. Because if you have lost your ability to find things funny that lets us know you're pretty depressed.
Can we talk about why that is? I feel like it has to do with some of the chemicals that might be more present after birth. So the two that I'm thinking are cortisol and serotonin. Can you give us a little bit of advice on maybe how we can lower our cortisol levels or how we could increase serotonin?
Cortisol is that stress hormone that um, we experience it whenever our body is under difficulty, which can be as simple as we're thirsty or hungry, or it can be as big as, my toddler is screaming at me. Things that decrease, and cortisol happens when the brain has decided we are under attack. We're under attack. We have to marshal all of our resources to save us, which for most of us sends us to fight or flight or freeze. Fight or flight is we're going to see the mom rage showing up there. We're going to see the irritability showing up there. Freeze may be more where I'm just shutting down. I am not able to respond empathetically or know what's going on. So we want to trick the brain into thinking it's safe. If we trick our brain into thinking that we're safe, our cortisol is going to come down. Now, cortisol does not come down fast. It takes you about 20, 30 minutes minimum to bring cortisol back down. So it's ideal when we start to see it rising, if we can do some of those things that will trick our brain into thinking it's safe. As soon as we notice that coming up, it's going to be a lot easier than if it gets way up here. One of the things that can help trick our brain is those slow breaths. When we are activated in our stress response, our heart rate speeds up and our breathing becomes more shallow and rapid. So if we can counter that with long, slow breaths, especially on the exhale, our brain starts to go, wait, our breathing's slowing down. We're okay. It's kind of playing tricks with ourselves a little bit.
One of the tools that I used was visualizing. I had a picture of a tree in my closet, and even if I wasn't looking at it directly, I could remember the picture of that tree. And I chose that because trees are grounded, they have roots, and that helped a lot to bring down my stress level. So these are great points. And then serotonin, how could we increase the serotonin?
Serotonin, humor totally does. Memes are great. Very quick, very fast way of getting some of that. Another thing that can really impact that positively, nobody likes this idea, but the data is there, is cold showers. Quick cold showers, like 2 minutes or less, just kind of blast your body, will both increase your dopamine and your serotonin. And there's something, if you start your day with them, the effects of those will last.
And is this similar to the cold plunge?
It's all the same sort of like neuro and bioscience. But
Do you have
it sounds like it would be hokey, but it's really, there's really actual studies about that. So sometimes when moms are like, I don't have time to meditate, I don't have time to, do any of these things you're telling me to do, I'm like, can you blast yourself with cold water in the shower in the morning? Like, it doesn't have to be very long. Just as long as you can stand it and then turn it off. Can you do that?
One tool that I also found helpful is music. There's a bunch of stations, streaming platform you enjoy, but if you say low flow for anxiety, they'll actually give you an entire song that is one pitch. So it's like one frequency range. It almost sounds like the ancient chants. But I found that if I can just even close my eyes and turn that on for a few minutes, there's more regulation in my system. So my boys are young, right? They're 6, 4, and 2. So there's always lots of noise. There's always lots going on. And sometimes I just need to regulate.
And it doesn't actually take as long to regulate as we think that it does. Things like visualizations and container exercises are some of the things that I teach clients. And when we're learning them in session, we'll teach them and we'll practice them. And then I'll be like, okay, I want you to think about something that's going to make you upset. They get themselves upset. And I'm like, now use your tool, go, and we'll time how long it takes for her to bring herself back down to calm. The longest I have ever seen was about 1.5 minutes. Like we can actually bring ourselves down pretty quickly if we have some tools that we're familiar with, and we will let ourselves take the time to do it and remind ourselves this isn't a lot of time. Like it's maybe 2 minutes, but I'm going to get this big payoff. So can I stop? And anxiety and cortisol and distress are going to tell you, you can't stop, you can't stop. So that's a challenging thing. I do not want to minimize how difficult that really is. But if we can be like, okay, I'm going to do my breaths, or I'm going to listen to music, or I'm going to look at some funny memes, or I'm going to turn on some dance music, or, I'm going to go outside and just put my face in the sun. The payoff we get for those few minutes can last the whole rest of our day.
Are you familiar with the book 90 Seconds to the Life You Love? He talks exactly about the minute and a half that it takes for an emotion to work through our body, and that we need to practice accepting our emotions in a more gracious way instead of always trying to cover them up or make them stop, is actually letting them flow through us. He also gives that suggestion of how we help our children to manage their emotions, right? So often we just want to shut them down.
Stop.
And if you start in your head just counting to 90, unless they're in kind of like that red brain tantrum mode, 90 seconds and a big hug for your child can be the magic combination.
I love all of these practical suggestions in the moment. It's so nice to have these tools when we're in that stage of needing to come back down. I also have found visualizations beforehand, whenever you can do that, is incredibly helpful too. I remember just thinking through the next day, what problems might arise? What am I experiencing tomorrow? And they found that with athletes and performers and people that visualization can really change and affect their day as if they've already gone through it. And so you can have a head start if you're able to do that even beforehand.
Yeah. I think one of the challenging things about all of this stuff that we're talking about is it can feel like one more thing to a woman who already is completely maxed out. And so when I'm working with moms on making some changes, there's so many things we can change. We are never going to pick more than one, maybe two in a week that we're going to focus on. So are we going to focus on, getting a little bit more sleep this week? Are we going to focus on like doing some deep breaths when you notice you get activated? Are you going to practice thinking through your day the night before? But we're only going to pick one or two because it is really tough and challenging to be a new mom, whether it's your first time at all, or, this is just a brand new little person here and you have other little people. It's a lot. And the shifts we want to make don't have to be big to make a big difference. It's one of the reasons why I love working with postpartum women so much. It's some of the fastest mental health work I've ever done in my life because little shifts make a big difference.
Just because we have all these tools in our toolbox doesn't mean we need to use them all at once. We can use the ones that fit at that time.
Can I ask a quick question about either supplements or medication? Do you have anything that you recommend and have seen success with?
I'm a big fan of medications when a mom is really struggling. And we can kind of gauge that through some standardized screening tools. And there's certain like cutoff bench points where we're like, this level of what you're experiencing is heavy enough that all of these other interventions that we're trying to apply, you might need a little support from a medication to help you with that. Otherwise, you're going to be trying to do all of these tools and trying to do all of these things, and you just can't. So I feel like medication can be incredibly helpful and supportive for moms when they're trying to recover. And we don't need to be worried or afraid that, because I'm pregnant or because I'm breastfeeding, I can't do medications. There's ways to do that are very, very safe. Take care of mom and take care of baby. So I think medication can be really, really good thing. Over-the-counter supplements, we want to look at what research says, and we want to look at what does the data say is supportive of mental health. One of the problems with supplements is we want to be very careful what we're using because the research is not done on those. So there are some that are out there and people like, oh, for example, St. John's wort. We'll take that for depression. We don't have the research on that we have on, say, Prozac. So you need to consider that. Just because something is quote unquote natural doesn't mean that it is only beneficial and could not have negative side effects. So it's something very important to consider and ideally talk through with your doctor. Some of the supportive supplements that I do talk to my moms about, because the data is solid, is omega-3 fatty acids, particularly in higher dosages, around 2,000 or 3,000 milligrams a day, have been shown to be very supportive for postpartum mental health. Magnesium also is quite supportive and can help with sleep. Different kinds of magnesium, some of them can upset your tummy, so you got to pick the right ones for that. And anytime a mom wants to do anything like that, though, I really recommend she talk to her doctor about that and her pharmacist. Pharmacists sometimes more than doctors do about meds, and make sure it's not interacting with other health conditions she has or stuff like that.
That's so true. And what are the nutrients or the vitamins that maybe our body has lost through the pregnancy process, like a simple B6?
Keep taking your perinatal vitamins at least through the first trimester after baby's born. We call that the fourth trimester.
We have talked about so many things we can do at home to help us throughout this postpartum period. What about when there's outside help that's needed, but women don't have access to a therapist or other help that they may require?
Luckily, these days, there are resources available. It may not always be exactly the way you want it. So if a woman is like, I really want to go to individual therapy, but I don't have the resources for that, that can be really hard to find that. Maybe she will have to do a support group, or she could do a therapy group, which is much cheaper than individual therapy. At my clinic, the Healing Group, we offer a postpartum therapy group that runs for 8 weeks, and it is closed and limited to a small number of participants. They have a therapist, they get psychoeducation, they get therapy, and the cost of it is about the cost of one therapy session. So there are some options like that available. I think podcasts can be, like such as yours, can be a great resource for information and for support. There are some online groups that can be helpful. Got to make sure you get into one that's really supportive, or reaching out to your friends and your family around you. Sometimes just letting someone know I'm having a hard time can open some real floodgates of some support and help.
We love to share resources on this podcast and want to find out if you have any books that you would recommend to our listeners.
One of my favorites is Good Moms Have Scary Thoughts by Karen Kleinman. And it is a cute little book it's adorably illustrated, and Karen Kleinman is considered to be the mother of postpartum mental health treatment. She's one of the first professionals who identified it as a specialty and developed books and trainings around it. So she's put together this really great book that runs through some of the primary concerns and issues that show up in the postpartum period. Cute little graphic pictures, kind of cartoon style, really, really accessible for moms and for partners. Partners often need education about what this period is like. They don't know. And what it looks like to them on the outside can be completely different from what moms are experiencing on the inside.
One of the books that came to mind for me was Baby Wise. You had mentioned how sleep is so crucial in this period. And a lot of times we don't recognize that we are the sleep trainers or the teachers for our baby. If we can help teach our baby how to sleep, it will give us better sleep. There was a quick quote that they shared in that book. Teaching your baby to sleep independently is one of the most loving and beneficial gifts you can give. When your baby sleeps well, the entire family benefits. A well-rested baby contributes to a more peaceful and balanced home life.
I would agree with all of those comments on how positive sleep is. How moms and families choose to handle sleep, I'm sure you know, is such a hot topic. And I really want them to consider it from an attachment perspective as well. Be really thoughtful about how they do that and have it be something that the family works together on. How can you help support mom? Sometimes it's just sort of like, well, she'll figure it out, instead of it being like, this is a family issue. How do we work together on this?
Yes. One thing we do every week is we end our episode with a Mom Squad secret. And this week comes from an 8-year-old, Azazel, and he says, use a quiet voice and soft touch around a newborn. So we talk about things like some people like to use noise so that their baby gets used to noise. Other times when we're around the baby or trying to get them to sleep, using that gentle touch. So even this 8-year-old is aware of how to help the baby try to sleep.
And your suggestions for incorporating family communication about sleep is so pertinent. Husband and I were able to really come together on some sleep methods and having him kind of take the lead for helping our baby to sleep and recognizing that it would improve everybody's moods. But like you said, sleep is such an individual thing, and knowing even when you can start sleep training a baby versus when that baby really needs you throughout the night, all of those things are so important. And pediatricians and your own doctors, those are great resources. Work through how you're going to get back to that 4 hours or hopefully more.
And sometimes outside help is needed. I know a friend who her baby was 2 before he was really having a good sleep experience, and they did require. Yes, right? And so
It takes a while.
and
The thing about parenting is, I mean, you would think it would be more standardized by now. We've been doing it for, millennia, but it's really such an individual situation. And the child that you're raising currently is going to respond to things differently than maybe other children you've had or children you're going to have. And there's so much room for doing parenting and mothering well within what works for you and your circumstances and your baby. And the things we want to kind of try and keep as like our guiding stars, as we want to build good relationships together. We want to have good mental health together. And if we can do that, whatever it takes to get us there, that's going to be just great.
that's exactly what we're hoping to achieve on this podcast. We're helping people find the best birth for them and in their individual circumstances, because as you mentioned, it is so individualized.
Reva, thank you so much for coming on our podcast. Is there anything else that you would like to share as we close today?
I would love for moms to know that when they are struggling, that is not their fault. They did not cause it, but with the right support and help, they can be well.
Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.